Medicare Advantage scandal: why John Oliver's report shocked millions. Let's be honest, most seniors were sold a dream called Medicare Advantage. Ads promised $0 premiums, free dental, free vision, and a card that would simplify your healthcare. But behind those smiling commercials, something darker has been going on. And this week, a national TV investigation led by John Oliver blew the lid off the truth, exposing how some insurance giants are quietly turning a government safety net into a profit machine. And yes, millions of American seniors are paying the price. Because when it comes to Medicare Advantage, what looks like a better deal might actually be a trap, one that could decide whether you get the care you need or get denied when it matters most. For years, companies like UnitedHealth, Humana, and CVS have made billions from Medicare Advantage. They run flashy ads with happy retirees playing golf, promising you'll save money. But as John Oliver revealed, those ads hide the real truth, that these private plans often delay or deny coverage that original Medicare would have paid for instantly. Imagine this. You've worked your entire life, paid into the system, and now, when you finally need surgery, therapy, or a scan, the insurance company says, "Sorry, that's not covered under your plan." And you're left wondering, wait, isn't this Medicare? Why am I fighting with a private insurance company just to see my doctor? John Oliver's team exposed the ugly part. The system incentivizes insurance companies to deny care. Every test or treatment they avoid paying for means more profit. That's the advantage, but not for you. According to the Congressional Budget Office, Medicare Advantage is now costing taxpayers nearly $590 billion more than traditional Medicare. Think about that. Almost $600 billion in extra costs. And where does that money go? Not into better healthcare, not into stronger hospitals, but into executive bonuses and marketing campaigns to sign up even more seniors. And here's the twist that made millions furious. When doctors recommend procedures, many Medicare Advantage plans use something called prior authorization. Basically, a corporate gatekeeper who decides whether you deserve the treatment your doctor says you need. It's bureaucracy on steroids. And for older Americans, those delays can be life-threatening. John Oliver's investigation shared heartbreaking stories. Seniors denied cancer scans, physical therapy, even rehab care after a stroke, all because their private plan found a technical reason not to pay. Think about how cruel that is. You've paid into the system for decades. You trust Medicare to protect you, and then at your most vulnerable moment, a profit-driven algorithm decides your life isn't worth the cost. And Washington, they know this. Lawmakers have held hearings, watchdogs have filed reports, and still, the machine keeps running. Why? Because these companies spend millions lobbying Congress to keep the system exactly as it is. Let's call this what it is, a betrayal. A betrayal of every hardworking American who believed Medicare was a promise, not a business opportunity. The truth is, Medicare Advantage has become a goldmine for insurance companies. They collect government money for every person who signs up, even if they deny care later. The more they sign up, the more they earn. And the less care they approve, the more profit they keep. That's why John Oliver's report hit so hard. It wasn't just about numbers. It was about people, our parents, our grandparents, our neighbors, struggling through endless paperwork just to get basic health care they already earned. And here's the kicker. Every time someone is denied care, the company saves money. Every time a doctor gets frustrated and gives up fighting, the company saves money. And every time a senior dies waiting for approval, the company still saves money. That's not healthcare. That's corporate greed disguised as choice. And those so-called $0 premium ads, they're a classic trap. You might not pay up front, but you'll pay later. Through denied claims, hidden costs, and endless stress, many seniors don't even realize they're giving up original Medicare's full coverage when they switch to these plans. Now let's talk about the politics. Both parties know this system is broken. Democrats talk about reforming it. Republicans say they'll protect Medicare. But year after year, nothing changes because insurance lobbyists write the rules, not you, not your doctor, and certainly not the patients living this nightmare. And what does the government do? They brag about Medicare savings while turning a blind eye to how those savings come from denying seniors the care they need. It's a scam hiding in plain sight, so what can you do about it? First, know your plan. Don't be fooled by flashy Advantage ads. If a plan sounds too good to be true, it probably is. Second, read every detail before you switch during open enrollment. Ask your doctor which plans actually pay on time. Ask your hospital which plans they refuse to work with, because that tells you everything. And third, speak out. If you or someone you love was denied care under Medicare Advantage, report it. Tell your story. When enough seniors speak up, Washington won't be able to ignore it anymore. John Oliver's investigation did what our leaders should have done years ago. Shine a light on a system that's failing millions. But now it's up to us, the people, to make sure that light doesn't fade. Because at the end of the day, Medicare wasn't built for profit. It was built for protection. And if we let that promise die, then what does that say about us as a nation? So ask yourself this. Are you getting the care you earned or just the care your insurance company allows? Because the truth is, they call it Medicare Advantage. But for millions of Americans, the only ones with the advantage are the corporations cashing the checks. And before you go, in our next video, I'll show you how to protect yourself from fake $0 plans and how to switch back to real Medicare before it's too late. If you care about your health, your family, and your future, you won't want to miss it. Because this fight isn't over, not by a long shot.